angular and circular types of movements. So the first one, I guess I'll get the light on me. We can go flexions and extensions, and just generally, general terms, our textbook even talks about it this way. You drop a coronal plane or a frontal plane, you drop that down. Anything anterior to that is going to be a flexion. Anything posterior to it, our textbook is saying it's hyperextension. This is where things may vary. So you go in, you start working at your job, and they tell you to hyperextend the patient's shoulder. You're like, all right. Sometimes, it depends on your setting, so make sure you figure that out. Sometimes hyperextension is beyond a normal range of motion. So keep that in mind, all right? So know just before you do something, man, are they sure they want me to hyperextend this thing? So there's our coronal or our frontal plane, right? We get to that lab 1. Anything anterior to it is going to be a flexion, for the most part. There's always exceptions. So elbow flexion, elbow extension. Our textbook is saying extension is a return to the anatomical position. So here's the anatomical position, elbow flexion, elbow extension, wrist flexion, wrist extension, finger flexion, finger extension. Here's my hips. These hips don't lie. Here's I can prepare myself for this amount of shape. Hip flexion. You can also call it thigh flexion. That's about all you're getting from me. Thigh flexion. Woo! Starting to cramp up. That was thigh flexion. Thigh extension. Neck flexion. Extension. And then I'll go hyperextension. For our purposes, according to our textbook. I'm going to do shoulder flexion, shoulder extension, and again, according to our book, hyperextension of the shoulder. So that's how that works.
How you gonna do this on a test? You gotta stand up there and like, are you gonna seriously do that?
I'll be like, what am I doing? Wrist flexion and horizontal shoulder, and yeah, I'll do the movements because that's easier than having you describe them. What else we got? So we did some angular movements. Circumduction. Gotta realize that there's something there. Circumduction is this. This is not a rotational movement. They use the analogy of a pencil lead touching a paper and then just making a circle or spinning it along that axis. I shouldn't say spin, twisting. Circumduction is not a circular movement. If you're rotating, that's when you get to a rotational type of movement, which we'll do next. After I go plantar and dorsiflexion. So with your feet, plantar flexion, you're planting or you're flexing the plantar aspect of your foot. So plantar flexion, boom. Dorsiflexion, you're flexing the dorsum of the foot. So with flexion, you're decreasing the angle between two segments. So elbow flexion, I'm decreasing the angle. Elbow extension, I'm increasing that angle. Dorsiflexion, toe up. Plantar flexion, toe down. Plantar flexion you can also call extension. I learned it plantar and dorsiflexion, but you can also call that extension and flexion. The exception for the flexions and extensions, either anterior or posterior to the coronal plane. This is knee flexion. Your textbook doesn't even mention knee flexion or show a picture of that. So that's knee flexion. That's knee extension. Now notice knee flexion is posterior to that coronal plane. Lateral flexions. We ready for some angular types of movements now? Basically, if you curl up into the fetal position, you're fully flexed. Now let's go some circular types of movement. We're going to go supination, pronation. So you're holding soup in your hand. You're supinated. When you go here, you're pronated. You're prone it away. Supination. I didn't come up with that. It works out good though. So supination, pronation. Supination, pronation. Internal and external rotation, or medial and lateral rotation. I don't know what your book says it as, but they're both, you can use them interchangeably. So now if you're at the humerus, we're not pronating and supinating. We're going to, boom, do this one. So we got internal rotation or medial rotation. You spin it to the outside. There's lateral rotation or external rotation. Another easy way of seeing it is this way. So you're here, internal rotation, external rotation. Medial rotation, lateral rotation. So you're there. Medial rotation, lateral rotation. Flashing. So those were angulars, pronation, supination. What else we got?
Abinad.
Ooh, oh, those are angular. I forgot about them. So adduction. You're bringing your segment towards the midline. Abduction, abduction. You're going away. You're taking it away. You're being abducted by an alien. Let's put a positive spin on that. Would that be a positive spin? I don't know what that.
Well, I mean, at the gym, you have those machines for hip abduction.
Oh, yeah. Yeah, so you're in the gym, you have the hip adductor and abductor. Those are always fun to do. So, abductor, abduction, away. Adduction, towards. You can use your hand. We're going to use our third phalanx and our third metacarpal as the midline. So, adduction, abduction.
Look at the B and the D, it tells you too.
Yeah.
The B is pointing away from the A and the D is pointing towards the A.
Ah, nice. Hear that? The D, look at the B and the D. The B is pointing away, the D is pointing towards. You're adding it, or you're abducting. Opposition. Oh, I better use that hand. This hand works better. Opposition and reposition. Opposition, reposition. Ulnar deviation, or, well, you can use adduction. I'll show you this. Hold on. Adduction and adduction and abduction. So you're adding it, adduction, abduction. So you got 1, 2, 3, 4. Or you can call it, what bone's right there on this side? Ulna's on this side. What's on the thumb side?
Radius.
Radius. So you can have ulnar deviation or radial deviation. Ulnar, radial. That's why you can practice this when you're in the grocery line too. Then you seem to move ahead real fast in the line too. It works out.
Protraction or retraction?
Protraction and retraction. They show the jaw, but protraction, it's going out. Protraction. And then retraction is good. Retraction, ready? It goes back.
So like
That might get you ahead further in the grocery line.
That'd be.
While you're doing the deviation.
It's like a mating dance.
So underbite.
What is it?
So underbite and overbite, basically.
Yeah, under and over. Yeah. It's protracted. You just got real nasty. Or retracted. That's when you grow the big bushy goatee so they can't see it. They show it with the jaw because it's the easiest, but scapulus, protraction. You're rounding your shoulders. Your scapulas they're opened up. Protraction and then retraction. You get the cold water dump time. Retraction, protraction, retraction. Elevation and depression. You can use your jaw, elevation, depression, it's open. Or your scapulas, again, elevation, you're all elevated when you take the quiz, and then by the time you get halfway through, you're just depressed, so they're lower. Elevation, depression, protraction, retraction.
Eversion and inversion?
Yeah, eversion and inversion. So think about the plantar part of your foot, the bottom of your foot. With inversion, that plantar portion is pointing in. Yeah, so you're inverted. Eversion, it's pointed out. So there's eversion, there's inversion. Am I forgetting anything? So what would I be doing here?
Knee
Flexion.
Flexion. Yep, flexion of what?
Knee.
The knee. How about this? Ah, point to it now.
Flexion.
Yep, flexion of the shoulder. How about, if you call this extension or hyperextension, it's good to go with me. So what would this be?
Hyperextension of
Yep, shoulder hyperextension.
So they're referencing extension as like a neutral position.
Yeah, they say all extension returns you to the anatomical position.
Okay.
So you're here. I learned extension as anything posterior to that coronal plane. So again, it depends on where you're working. So whoever's signing your paychecks, you do whatever they want as far as flexions and extensions go. How about this one?
Dorsal.
Dorsiflexion.
Flexion. Flexion.
Yeah, dorsi and plantar flexion. So there we go. Dorsiflexion. I just started watching the dance. Plantar flexion, dorsiflexion.
Your dorsiflexion, your dorsal fin.
Yep, the dorsal move your foot. You're flexing it. You're decreasing that ankle. I want to get down. What else we got?
Circumduction.
Circumduction? Want me to do both hands? No! There's circumduction.
It's when the point is still and the outside is when they're out.
Yep. Yep. It's like that pencil on the paper, you're just spinning it around. Circumduction. I think we hit them all.
Yeah.
All right.